My name is Dr. Elena Volkov, and I've been a diagnostic radiologist at NYU Langone Medical Center in Manhattan for 26 years. I spend my days examining thousands of CT scans and MRIs, searching for abnormalities that explain my patients' symptoms. I look for tumors, fractures, bleeds, infections, evidence of disease written in shades of gray. I've read over 3,000 imaging studies in my career. I can identify pathology from the subtlest shadow, the smallest density chain. But what I began seeing on November 3rd, 2023, wasn't pathology that existed in the present. It was pathology that would exist in the future. My scans started showing me how my patients would die 48 hours before it happened, and there was nothing I could do to stop it. NYU Langone is one of the premier academic hospitals in New York City. Our radiology department reads hundreds of studies daily. I work alongside residents and fellows, training the next generation. I immigrated from Moscow in 1989 when I was 23. I repeated my entire medical training in English while working night shifts as a hospital translator. It took 10 years to become a fully licensed radiologist in New York. Those years taught me patience, precision, and careful observation. In radiology, you can't afford to miss things. A subtle finding could be early cancer. A small density could be a stroke. Lives depend on what radiologists see or fail to see. I've always been good at seeing, perhaps too good. November 3rd, 2023, started as an ordinary Friday. I arrived at 7 a.m., settled into my reading room, a usual black coffee. My first case was a routine chest CT for a 45-year-old woman with a persistent cough. I began my systematic review. Everything appeared normal. Then I saw it. In the right lung, there was a shadow, not a nodule or mass, something different. A faint, almost transparent overlay, like a double exposure. It showed extensive consolidation throughout the right lung, but when I adjusted the window settings, the consolidation disappeared. The underlying lung tissue was normal. I called my colleague, Dr. James Park. James, do you see that opacity in the right lung? He studied the images. I don't see anything. The lungs look clear. After he left, I stared at the images. The shadow was there. I could see it clearly, but apparently I was the only one who could. I dictated my report. Lungs are clear, no acute findings. I didn't mention the shadow. 2 days later, on November 5th, that same patient, Sarah Martinez, was admitted to the ICU with severe pneumonia affecting her entire right lung. She developed symptoms rapidly, going from minor cough to respiratory failure in 48 hours. I pulled up her chest CT from November 3rd. The shadow I'd seen now matched her actual pneumonia exactly. The scan had shown me what would happen 2 days later. But that same day, I read a head CT on a 67-year-old man with mild headaches. The scan was normal, but I saw a shadow, a large hemorrhage in the left basal ganglia. 48 hours later, that patient had a massive stroke in the exact location. He died within hours. Over the next week, it happened again and again. I'd see shadows showing future pathology. A bowel perforation 2 days away. A pulmonary embolism that would occur in 48 hours. A ruptured aneurysm that didn't exist yet. And always, the shadow became reality exactly 48 hours. I started keeping notes. After 15 cases, the pattern was undeniable. The shadows appeared 48 hours before the fatal event. Not 47, not 49, exactly 48. The scans were showing me the future. On November 17th, I read a chest CT on a 32-year-old woman named Jessica Chun. She'd come to the emergency department with chest pain, worried about a heart attack. Her CT scan was normal. No pulmonary embolism, no pneumonia, no cardiac abnormalities. But I saw the shadow, massive pulmonary emboli in both lungs, the kind that cause sudden death. I sat in my reading room, staring at that image, my hands shaking. If the pattern held, Jessica Chun would develop fatal pulmonary emboli in exactly 48 hours. On November 19th, at approximately the same time her CT was performed, for the first time, I faced a choice. Do I tell her? Do I warn her about a death I see but can't prove? I called the emergency department attending. Dr. Morrison, this is Elena Volkov in radiology. I'm reading the chest CT on Jessica Chun. The scan is technically normal, but I'm concerned about risk. Her D-dimer is elevated and she has risk factors. I'd recommend starting anticoagulation prophylactically. Her D-dimer is only mildly elevated, Dr. Morrison said. And she's young, healthy, no significant risk factors. I don't think prophylactic anticoagulation is warranted based on this clinical picture. I understand, but I have a strong clinical concern. Could you at least keep her for observation? Elena, we can't admit every young person with chest pain and a normal CT. She's being discharged with outpatient follow-up. I wanted to scream. I wanted to tell him that I'd seen her death, that it was written in shadows on her CT scan, that she had 48 hours to live. But how could I explain that? He'd think I was losing my mind. Maybe I was. After my shift, I did something I'd never done before. I looked up Jessica Chen's contact information in the medical record system, a violation of privacy protocols, but I was desperate. I called her cell phone. Ms. Chen, this is Dr. Volkov from NYU Langone Radiology. I read your chest CT. Oh, yes. The doctor said everything was normal. The scan is normal, but I'm concerned about blood clot risk. I want you to be very careful over the next few days. Any shortness of breath, any chest pain, any leg swelling, you come back to the emergency department immediately. Don't wait. And I'd like you to consider taking aspirin daily for the next week as a precaution. Is something wrong with my scan? No, the scan is normal, but sometimes we worry about things that don't show up on scans. Please, just be very careful. She agreed, though I could hear the confusion in her voice. For the next 48 hours, I barely slept. I checked the hospital admissions system obsessively, terrified I'd see Jessica Chen's name appear in the ICU census. November 19th came and went. No admission, no death. On November 20th, I called her again, using a hospital line, this time to make it seem more official. Ms. Chun, this is Dr. Volkov. I wanted to check on you. How are you feeling? I'm fine. Actually, I developed some mild leg swelling yesterday, so I went to my primary care doctor like you suggested. She did an ultrasound and found a small blood clot in my calf. She started me on blood thinners. She said it was good we caught it early before it could travel to my lungs. I closed my eyes, relief flooding through. The blood clot that would have caused the massive pulmonary emboli I'd seen in the shadow. She'd found it, treated it, prevented the fatal outcome. The shadow had shown me her death, but by warning her, by convincing her to be vigilant, we'd changed the future. Or had we? Maybe the shadows only showed probable futures, not certain ones. Maybe by acting on what I saw, I'd created a different timeline. I started intervening more actively. When I saw a shadow showing a fatal event, I'd find ways to warn the patient or their doctor. Sometimes I'd claim I saw subtle abnormalities that warranted closer monitoring. Sometimes I'd invoke clinical concern based on risk factors. Sometimes I'd outright violate protocols and contact patients directly. I saved 8 lives in 3 weeks. 8 people who would have died based on what I saw in the shadows, but who survived because I intervened. But the shadows kept coming, and I couldn't save everyone. On December 1st, I read a trauma CT on a 19-year-old man named Marcus Williams. He'd been in a minor car accident, needed imaging to rule out injuries. His scan was completely normal, but the shadow showed massive internal bleeding from a ruptured spleen, the kind of injury that would be fatal without immediate surgery. I called the trauma team. This patient needs monitoring. I'm concerned about delayed splenic rupture. His scan is completely normal, Dr. Volkov. We're discharging him. Please keep him for observation. Just 24 hours. We can't justify admission when the scan is normal and he's clinically stable. I tried everything. I called his parents. I called his primary care doctor. I even went to the emergency department in person, something radiologists rarely do, to examine him myself and advocate for admission. They thought I was overreacting. The trauma surgeon was kind but firm. Elena, I appreciate your concern, but we can't admit patients based on theoretical risks when all objective data is reassuring. Marcus Williams went home. 48 hours later, he came back to the ED with abdominal pain and collapsed in the waiting room. Ruptured spleen, massive internal hemorrhage. He died in the OR. I attended his autopsy, which I'd also never done before. The pathologist confirmed massive splenic rupture with hemorrhage. Probably had a small laceration from the initial accident that progressed over time. These delayed ruptures are rare, but deadly. I stood in that autopsy suite, staring at the organs laid out on the and I wanted to scream. I'd seen this. I'd seen his death 48 hours before it happened. I'd tried to prevent it, but I couldn't convince anyone to listen. This was my curse, to see death coming and be powerless to stop it. On December 8th, I read a routine brain MRI on a 50-year-old woman named Patricia Moore. She'd been having mild headaches, nothing dramatic. Her MRI was normal, no masses, no bleeds, no abnormalities. But the shadow showed a massive subarachnoid hemorrhage from a ruptured aneurysm. I could see it clearly, the bright blood spreading through the subarachnoid spaces, the telltale pattern of catastrophic. I called the ordering neurologist. This patient needs a CT angio. I'm concerned about an aneurysm. Her MRI is normal. Elena, there's no indication for further. I have a strong clinical suspicion. Based on what? If you saw an aneurysm, it would be in your report. You dictated the MRI as normal. He was right. I dictated it as normal because that's what everyone else would see. The shadow was visible only to me. I tried a different approach. I called Patricia Moore directly. Ms. Moore, I'm Dr. Volkov. I read your brain MRI. The scan is normal, but I'd like you to have one additional test, a CT angiogram, to look at your brain blood vessels. It's just a precaution. My doctor said the MRI was fine, and my headaches are probably just stress. I know, but I'd feel better if we did this one additional study. I can schedule it for you tomorrow. Will my insurance cover it? My neurologist didn't order it. I'll make sure it's covered. Please, it's important. She was skeptical, but agreed. I scheduled the CTA for December 9th, hoping we could find the aneurysm before it ruptured. But on the morning of December 9th, before her scheduled CT, Patricia Moore had a massive subarachnoid hemorrhage at home. She was rushed to our emergency department in a coma. The CT scan showed exactly what I'd seen in the shadow: widespread subarachnoid blood, ruptured aneurysm, devastating brain injury. She died 2 days later without ever regaining consciousness. I sat in the neuro ICU waiting room after they withdrew life support, watching her family grieve, knowing I'd seen this coming and failed to prevent it. The shadow had given me 48 hours that I'd wasted trying to convince people, trying to work within a system that couldn't see what I saw. That night, I sat in my apartment in Queens, drinking vodka, staring at the wall. I was 58 years old. I'd spent my entire adult life learning to read medical images with precision, and now I was seeing too much. I was seeing death itself, and the knowledge was destroying me. I developed insomnia, lost 12 pounds in 5 weeks. Every time I sat down to read scans, I was terrified of what I might see. On December 15th, I saw Dr. Sarah Goldstein, a psychiatrist. I've been experiencing stress. I keep seeing patterns that worry me. I'm having trouble separating what's real from what's anxiety. She prescribed anti-anxiety medication and suggested I take a leave of absence. You've worked 26 years without a break. You're burned out, but this wasn't burnout. This was something else entirely. I didn't take the leave of absence. I couldn't, because if I stopped reading scans, I'd stop seeing the shadows. And if I stopped seeing the shadows, people would die that I might have been able to save. On December 22nd, I read a chest x-ray on a 14-year-old boy named David Park. He'd come to the ED with flu-like symptoms. His chest x-ray was normal, clear lungs, normal heart size. But I saw the shadow, massive pulmonary edema, the kind seen in severe congestive heart failure or overwhelming infection, the kind that kills rapidly. This was a child, 14 years old. I couldn't let him die. I called his mother directly. Got her number from the medical record. Mrs. Park, this is Dr. Volkov from NYU Langone. Your son was in our emergency department today. I need you to bring him back tonight. The doctor said he just has the flu. I know what the doctor said, but I'm concerned about his heart. I want him evaluated by a cardiologist. Tonight, his chest x-ray was normal. They told us. Mrs. Park, I am a radiologist. I read the chest x-ray, and I am telling you, mother to mother, please bring your son back to the hospital right now. There was a long pause. You're scaring me. Good. Be scared. Be scared enough to bring him back. She brought him back. The ED physician was confused. The boy looked fine, stable, just flu symptoms. But I'd created enough alarm that they admitted him for observation. At 3 a.m. on December 24th, David Park went into acute heart failure. He had undiagnosed myocarditis, viral infection of the heart muscle that had been brewing asymptomatically. It hit suddenly and severely, exactly as I'd seen in the shadow. But because he was already in the hospital, already on monitors, they caught it immediately. They transferred him to the cardiac ICU, started aggressive treatment, supported his heart function until the inflammation subsided. He survived. He was discharged on December 30th, healthy, with normal heart function. His mother found me in the radiology reading room on her way out of the hospital. Dr. Volkov, the cardiologist, said David would have died if we'd stayed home, that we brought him back just in time. How did you know? I looked at this woman, this mother whose son I'd saved by violating every protocol and professional boundary I'd been taught. I just had a feeling. I said, sometimes you have to trust your instincts. She hugged me, crying, thanking me. After she left, I sat in my darkened reading room and wept. I'd saved him. I'd seen his death in the shadows, and I'd prevented it. But at what cost? I was violating patient privacy, calling people at home, making diagnoses based on things I couldn't explain to anyone. I was operating outside every professional norm, driven by visions no one else could see. How long could I continue like this before I was reported, investigated, fired, or worse? On January 3rd, 2024, I read a routine abdominal CT on a 44-year-old woman named Rebecca Turner. The scan was ordered to evaluate vague abdominal. Everything was normal. No masses, no inflammation, no acute findings. But I saw the shadow, a massive aortic dissection, the deadly tear in the body's main artery that causes rapid catastrophic death. I knew what I had to do. I called her, violated protocols again, told her to go to the nearest emergency department immediately. She went. They found nothing. Her aorta was normal. They sent her home, and the ED physician called to complain about me. Dr. Volkov, you're creating unnecessary alarm. This patient's scan was completely normal, and you told her she was having a life-threatening emergency. 48 hours later, Rebecca Turner collapsed at work from a massive aortic dissection. She made it to the hospital, but died in the OR. The shadow had been right again, but this time, my warning hadn't been enough. She'd been evaluated, cleared, sent home, and died anyway. Maybe some deaths couldn't be prevented, no matter how much warning I had. On January 12th, I was called to a meeting with Dr. Andrew Chin, the chair of our radiology department, and Lisa Martinez, the hospital's chief medical officer. Elena, we need to talk about some concerning Dr. Chin began. We've had multiple complaints about you contacting patients directly outside normal protocols, calling them at home, telling them to return to the hospital, making recommendations that conflict with their treating physicians. I'm trying to help them. I see things. We know you're a skilled radiologist, Lisa Martinez interrupted, but you're overstepping boundaries. You're causing alarm, ordering unnecessary tests, and in some cases, violating patient privacy by accessing records outside your clinical. The patients I've contacted, I saved their lives. David Park, Jessica Chun, others. They would have died if I hadn't intervened. And Rebecca Turner, Dr. Chen asked gently, you told her she was having an emergency. She was evaluated and found to be fine. Then you were proven right 2 days later, but by then she'd already been cleared by the emergency department. Your warning didn't help. I tried. We know you tried. But Elena, you can't carry the weight of every patient's outcome. You're a radiologist, not a fortune teller. Fortune teller. If only they knew how close to the truth that was. We're placing you on administrative leave, effective immediately, Lisa Martinez said. We want you to undergo a full psychiatric evaluation. We're concerned about your mental health and judgment. You're firing. We're trying to help you. Elena, you're one of our most experienced radiologists. But something is happening with you, and we need to understand what it is before you do clinical work. I cleaned out my reading room that afternoon. 26 years of work ended because I tried to save people from deaths I could see in shadows. For 3 weeks, I stayed home. I attended psychiatric appointments where I lied about what I was experiencing. I couldn't tell them the truth, that medical scans were showing me the future, that I was seeing death written in CT densities and MRI signals. They'd commit me. I was diagnosed with severe anxiety and occupational stress. The psychiatrist recommended retirement. You've had a long, successful career, Dr. Volkov. Maybe it's time to step away. Retirement at 58. Giving up the work I'd spent decades mastering because I developed an ability no one could understand or believe. On February 1st, 2024, I received a letter from NYU Langone. My medical license was under review. The medical board wanted to investigate whether I was fit to practice medicine. That same day, I received a different kind of letter from Rebecca Turner's husband, Dr. Volkov. I know you tried to warn my wife. She told me about your call, told me you seemed worried. We went to the ED like you suggested, but they said she was fine. I wish we'd listened to your instinct. I wish we'd gotten a second opinion, done more tests. Thank you for trying to save her. I'm sorry, we didn't listen carefully. I sat in my apartment, reading that letter over and over, and I finally understood what I was dealing with. This wasn't a gift. It wasn't a curse. It was Cassandra's fate, to see the future, to speak the truth, and to never be believed until it was too late. The Greek myth of Cassandra, the Trojan princess blessed with prophecy, but cursed so that no one would believe her warnings. She saw Troy's fall, warned everyone, was ignored, and watched her city burn. I was Cassandra, seeing deaths written in medical images, trying to warn people, being dismissed as anxious, unstable, overreacting. On February 15th, I made a decision. I wouldn't retire. I wouldn't give up, but I would change my approach. I started teaching. I contacted the radiology residency program at Mount Sinai, a different hospital where my reputation was still intact. I offered to give lectures on rare findings, on subtle diagnostic signs, on the importance of trusting your instinct as a radiologist. I didn't tell them about the shadows, but I taught residents to look closer, to trust when something felt wrong, even if they couldn't articulate why. I taught them that sometimes the most important findings are the ones you sense rather than see clearly. And privately, I continued my research. I documented every shadow I'd seen, every prediction that came true. I built a database of cases, timestamps, outcomes, evidence that I knew would never convince anyone, but that I kept anyway, because someday maybe someone else would develop this ability. Maybe another radiologist would start seeing shadows on scans, seeing the future written in medical images. And when that happened, they'd need to know they weren't alone. They'd need to know someone else had experienced this and survived it. I still see the shadows sometimes, even now that I'm not actively reading clinical scans. I'll see a news report about someone who died suddenly, and I'll remember reading their scan 2 days before, seeing the shadow that predicted their death. I carry the weight of the ones I couldn't save. Marcus Williams, Patricia Moore, Rebecca Turner, and dozens of others whose deaths I saw coming but couldn't prevent. But I also carry the ones I did save. Jessica Chun, David Park, 8 others whose names I've memorized, whose lives continued because I saw their deaths in shadows and intervened. Is it worth it? The professional consequences, the personal cost, the burden of knowledge I can't share? I don't know. Some nights, I think the curse of seeing should come with the power to prevent. What good is foreknowledge if you can't change the outcome? But other nights, I remember David Park's mother thanking me, tears streaming down her face. I remember Jessica Chen calling to tell me she was doing well on blood thinners, that her doctors said I'd probably saved her life by insisting she be vigilant. Maybe I couldn't save everyone. Maybe Cassandra's curse meant that most of my warnings would be ignored. Most of my knowledge would be dismissed as anxiety or instability. But I saved some. I changed some futures. I gave some families more time with their loved ones. And maybe that's enough. I'm 58 years old. I've spent 26 years reading medical images, looking for disease, searching for pathology. And for a brief, terrible, extraordinary period, I saw beyond the present into the future. I saw death before it arrived. I don't know why it happened. I don't know if it was a neurological phenomenon, a perceptual shift, or something beyond medical explanation. I don't know if I was seeing real futures or probable ones, deterministic fates, or changeable timelines. What I know is this: I saw shadows on medical scans that showed how people would die 48 hours later. Sometimes I prevented those deaths. Sometimes I couldn't. And I'll carry that knowledge, the weight of foresight, the burden of Cassandra's gift, for the rest of my life. The shadows have stopped now. I don't know if it's because I'm no longer actively clinical scans, or if whatever allowed me to see the future has simply ended. Part of me is relieved. Part of me feels like I've lost something essential, but the memories remain. The database of cases, the evidence of futures I saw written in shades of gray on computer screens. And if it happens again, to me or to someone else, I'll be ready. I'll know it's real. I'll know what it means. And I'll know that sometimes the most important thing a doctor can do is see what others can't, even if no one believes you, even if it costs you everything.